Welcome to the deep dive. Today, we're inviting you to consider something that, well, often flies under the radar, but has these really monumental consequences for animal health, our economy, and even our own well-being. We're talking about the incredible, often unseen world of bacteria in our food chain.
Exactly. And in this deep dive, our focus is bovine salmonellosis. That's a highly contagious bacterial disease. It's caused by salmonella and affects cattle of all ages.
Right, so our mission today is really to cut through the complexity of your source material, give you a shortcut to being well-informed about this whole issue. We'll unpack the nature of the disease, how it spreads, its immense impact, and the multifaceted strategies used to control it.
Think of it as a journey, maybe, from the smallest microbe to the biggest economic ripple effects.
And as you'll hear, the surprising resilience of these tiny bacteria and their significant zoonotic potential, that means it's a really important topic for everyone, not just those directly involved in agriculture.
It's a true One Health story, really.
Okay, let's start at the beginning then. What exactly is salmonellosis in cattle?
Okay, so at its heart, bovine salmonellosis is a contagious bacterial infection. In cattle, it typically causes enteritis. That's an intense inflammation of the intestines, and systemic infection, sometimes called septicemia. That's where the bacteria spread throughout the body. And in pregnant animals, it can even cause abortion.
Wow.
And as you highlighted, its ability to jump from animals to humans, well, that gives it significant economic and public health implications globally.
So who are the main bacterial culprits we're dealing with here? Are there specific types?
Yeah, the primary culprits are specific types, or serovars, of Salmonella enterica. The two you'll hear about most often in cattle are Salmonella typhimurium and Salmonella Dublin.
Typhimurium in Dublin, okay.
Right. S. typhimurium tends to cause acute severe diarrhea and widespread infection, especially hitting young calves hard. S. Dublin, on the other hand, is particularly interesting because it's highly adapted to cattle.
Adapted, how so?
Well, it means it can cause more chronic infections, and it's notorious, really, for causing persistent carriers. That's where an animal can harbor the bacteria without showing symptoms, but still spread it.
Ah, the silent spreaders.
Exactly. And we also worry about strains like S. typhimurium DT104. That one's especially virulent and resistant to multiple antibiotics, which raises, significant public health concerns.
You've made them sound like these incredibly adaptable organisms. I'm struggling to picture just how tough that truly means. Can you give us a really vivid example of their survival capability? Like, what's the most surprising characteristic?
Well, what's truly remarkable about these tiny organisms, beyond their shape, they're rod-shaped and gram-negative, which is a key trait making them tougher to treat with some antibiotics, is their unique flexibility. They're facultative anaerobic.
Facultative anaerobic, meaning...
Think of it this way. They're the ultimate adaptable survivors because they can thrive in environments with or without oxygen.
Okay, that is flexible.
Yeah, and this is precisely why they're such a challenge. While heat, like pasteurization above 70 degrees Celsius, kills them effectively.
Right, pasteurization works.
It does, but they show incredible resistance to desiccation, basically, drying out. They can survive for years in dried feces or dust.
Years, just sitting there.
Years. And they can also persist for months on pasture or in slurry. This incredible environmental resilience is just a critical factor in how the disease manages to persist and reappear. It's almost like a ghost in the system.
That's a truly stubborn bug, able to just hang around indefinitely.
Yeah.
Let's talk about the ripple effect of this persistence, particularly its zoonotic and economic impact. How does this connect to human health?
Okay, so Salmonella is a major global zoonotic pathogen. That means it's a significant public health concern worldwide. Human infection typically occurs through direct contact with infected animal feces or drinking unpasteurized milk.
Unpasteurized milk.
Or even indirect exposure, like via contaminated clothing, farm pets, or contaminated food products, especially meat and dairy.
So it gets around easily.
It really does. It's truly a one health issue, where the health of animals directly impacts the health of people.
And the cost. When we connect the dots, what's the economic burden of this issue? Can we put a number on it?
We can. And the staggering costs are a huge part of the picture. Beyond the raw numbers, the hidden insight here is maybe how deeply intertwined human and animal health costs are. Foodborne salmonella infections in humans. They're estimated to cost approximately $3.7 billion annually.
Hmm.
And that's just in the United States.
3.7 billion. Wow.
And what's even more sobering is that nearly 90% of that cost is attributed to premature deaths.
Oh, that's significant.
It is. And just for context, the broader economic impact of all foodborne pathogens in the U.S. was about $17.6 billion back in 2018.
So this is a major slice of that pie.
A very big slice. This isn't just about farming. It's a direct, measurable drain on our public health and our economy.
So if controlling it in cattle means protecting people, what about the economic burden directly on the cattle industry itself? What are farmers facing?
Yeah, for the cattle industry itself, particularly dairy operations,
Yeah.
the losses are seriously substantial. We're talking declining milk production, fatalities across all age groups, abortions in pregnant animals, and then significant treatment costs, plus the financial setbacks from antibiotic-contaminated milk that just can't be sold.
Right, the withdrawal times.
Exactly.
Yeah.
On top of that, you have increased culling rates, sometimes delayed culling, which costs more, heightened labor demands for sick animals, reduced feed efficiency, and restricted animal sales, all hitting market access and profitability.
Beyond the dollars and cents, this involves living, breathing animals. What are the animal welfare implications?
That's a really important point. Bovine salmonellosis leads to debilitating symptoms, progressive weight loss, severe debility, and potentially death. And the chronic nature of the disease, the way it can linger, that really prolongs animal suffering. It highlights significant welfare concerns. It's just a tough experience for them.
You mentioned subclinical infections and carriers earlier. Is there something happening beneath the surface that makes this even harder to grasp and control, like something hidden?
Absolutely. This is what we often call the iceberg effect.
The iceberg effect.
Yeah. The significant profitability drain isn't just from the overt, visible clinical cases that you see. It's also from subclinical infections and those carrier animals. So the visible clinical cases, they represent only a fraction of the true infection burden. Many infected animals aren't readily apparent, but they are still shedding bacteria and acting as silent sources of infection.
Which makes control incredibly challenging.
Exactly. And it highlights the need for robust surveillance that goes beyond just looking for obviously sick animals.
Let's delve into how this disease actually spreads and why it's so stubbornly difficult to get rid of. How do these bacteria infect an animal in the first place?
Okay, the primary route of infection is fecal-oral. Basically, an animal ingests contaminated feed, water, or just bacteria from the environment. Simple but effective for the bacteria. However, entry can also occur via the upper respiratory tract and even the eyes, the conjunctiva.
Through the eyes. Wow.
Yeah. Once inside, Salmonella colonizes the digestive tract, invades the cells lining the intestines, and also lymphoid tissues like the tonsils. From there, they multiply and spread to lymph nodes and then into the bloodstream, leading to that systemic infection, the septicemia we talked about.
What causes the actual sickness, the fever, and inflammation?
Crucially, the release of endotoxins. These are potent toxins released by the bacteria themselves, and they trigger severe inflammation, fever, and can even lead to septic shock.
And you hinted at antimicrobial resistance earlier. How has Salmonella evolved to evade our treatments? This sounds like a key part of the problem.
It really is. What's fascinating, in a worrying way, is that Salmonella has evolved truly sophisticated defense mechanisms against antimicrobial agents. Think of it like a tiny bacterial fortress. They can use enzymatic inactivation to basically destroy the antibiotic before it even gets in. Or they can actively expel antibiotics from their cells using what are called efflux pumps. Imagine like a mini bacterial bouncer kicking the drugs out.
Okay, a bouncer.
Or they can even make structural alterations to their own internal targets so the antibiotic just can't fit or bind to do its job.
So multiple lines of defense.
Absolutely. This inherent and evolved resistance contributes significantly to why the disease is so challenging to treat effectively. It explains the establishment of those persistent carrier states and the prolonged environmental survival we discussed. It's a constant evolutionary arms race, really.
So beyond individual infection, what are the main ways it jumps from one animal to another or from the environment back to an animal?
Well, the predominant route is definitely that fecal-oral one, through contaminated feed, water, or just a dirty environment. Direct contact between animals is also a major factor, especially in overcrowded or unhygienic conditions.
Makes sense.
Then there's vertical transmission. That's infection passed from mother to calf while it's still in the womb, or through contaminated milk and colostrum after birth. And it's really important to note, feeding pooled raw milk or waste milk to calves is a particularly high-risk activity for disease transmission.
Pooled raw milk. So mixing milk from different calves.
Exactly. Big no-no if you're trying to control this.
Gotcha.
And remember that environmental persistence we talked about. Salmonella can survive for extended periods, up to a year in soil and water, and many months in contaminated buildings. So the environment itself acts as a critical reservoir.
Right, the ghost in the system.
Precisely. Then there's indirect spread through contaminated equipment, what we call fomites. Things like feeding utensils, manure handling machinery, clothing, boots, even farm vehicles. And here's a surprising detail. High-pressure hosing, which you might think is good for cleaning,
Yeah.
can inadvertently aerosolize salmonella.
Uh-huh.
It creates tiny airborne particles containing the bacteria that can then spread infection within a facility.
Seriously, cleaning can spread it.
If you're not careful, yes, it kicks it up into the air.
That's an incredible number of ways for it to get around and spread. What factors make an animal more susceptible? Or can trigger an outbreak, maybe even if an animal is just a carrier?
Yeah, several key risk factors increase susceptibility. Age is a big one. Young calves, particularly those under 6 months, or those that didn't get enough colostrum, that crucial first milk with antibodies.
The colostrum, right, vital.
Absolutely vital. They are highly susceptible to severe disease. Susceptibility generally decreases with age, but older animals aren't immune.
So when we think about managing a herd, what's the most impactful factor that can trigger clinical signs, especially in those silent carriers you mentioned?
This is really key for herd management. Stress. Stress is a profound disease trigger.
Stress. Like what kind of stress?
Various stressors. Things like parturition, the act of calving itself is stressful, hot weather, transport, commingling, mixing new animals into a group, overcrowding, or even feed shortages. All these things can profoundly impact an animal's immune system. And these stressors can trigger full-blown clinical salmonellosis in latent carriers, or just make existing outbreaks much worse.
So stress reduction isn't just about general welfare.
No, it's a core, impactful prevention strategy for this specific disease.
Interesting. What else makes them vulnerable?
Well, any compromised immune status makes animals especially vulnerable. This includes cows around the time of calving. We call them periparturient cows. Also animals with concurrent diseases like bovine viral diarrhea, BVD, or liver fluke infestation, or metabolic disorders like milk fever, ketosis, or a retained placenta.
So other health issues pile on the risk.
Exactly. And finally, biosecurity breaches are highly significant. Bringing new animals into the herd, especially those asymptomatic carriers, represents the highest risk for introducing salmonella. And of course, poor hygiene, overcrowding, and contaminated feed and water sources also greatly facilitate spread once it's there.
Given all these complexities, how do veterinarians actually recognize the signs of salmonellosis in cattle? What does it look like in real life on the farm?
Well, the clinical picture can be quite varied. Salmonellosis manifests differently depending on the age of the animal and the severity of the infection. It's not always the same.
Let's start with those really severe cases, maybe in the young calves.
Okay. In young calves, typically 1 to 2 weeks old, you might see what's called peracute septicemia.
Peracute, meaning very sudden.
Very sudden, very severe. It's characterized by a sudden onset of very high fever, often 40.5 to 41.5 degrees Celsius. That's about 105 to 107 Fahrenheit.
Oh.
Along with that, extreme lethargy, a complete loss of appetite, and diarrhea. Death can occur very rapidly, often within just 24 to 48 hours.
That fast? Wow.
Yeah, and calves may show signs of septic shock. Mortality can be incredibly high, even approaching 100% in some of these extreme cases.
Okay, that's grim. What about acute enteritis in slightly older calves or adults? How does that manifest differently?
Right, so for calves aged maybe 2 to 6 weeks, acute enteritis typically means profuse, foul-smelling, watery diarrhea. It can often become bloody. You also see fever, dehydration, weakness, and weight loss. Mortality is still high without prompt treatment.
And are there specific signs linked to that S. Dublin strain you mentioned?
Yes, especially with S. Dublin infections, you can see more severe systemic manifestations. Things like sloughing of extremities, literally parts of the ears, tail tips, or hooves can necrose and die off.
Ah, that sounds awful.
It is. You can also see joint infections and sometimes weakness from infection in the neck vertebrae.
And in adult cattle.
In adults, typically a week old or more, acute enteritis usually begins with a high fever, which might actually precede the diarrhea. This is followed by severe watery diarrhea that can progress to dysentery, meaning it contains blood and mucus, and frequent straining, what we call tenesmus.
That's straining. Okay.
Yeah. The feces often have a putrid, really foul odor and may contain mucus, fibrinous casts, which are like stringy bits or even shreds of the intestinal lining. In dairy cows, you'll see a sharp, precipitous decline in milk production. Pregnant cows may abort, especially in the last third of gestation, and often have a retained placenta afterwards.
And what if it doesn't resolve quickly? Can it become a long-term problem?
Yes, that leads to what we call chronic enteritis. This can follow an acute episode. It's characterized by intermittent fever, usually a bit lower, maybe 103 to 104 Fahrenheit, but they have persistent watery diarrhea, progressive dehydration, and significant weight loss over time. Calves affected this way show poor growth, they remain unthrifty, and often end up being culled because they just don't thrive. They can't recover fully.
You've called the subclinical carrier state the iceberg a few times. Can you really unpack that for us? Why is it so significant for controlling this disease?
Right. The subclinical carrier state is incredibly significant because these are the animals that harbor salmonella maybe in their tonsils or their gut without showing any overt signs of illness. They look healthy.
They're not.
Exactly. They chronically shed bacteria, maybe just intermittently, but they act as silent sources of infection for the rest of the herd. Adult cattle are particularly prone to becoming these asymptomatic carriers.
And how long can they shed for?
It varies. S. Dublin, the cattle-adapted one, can actually be shed for an animal's entire lifetime.
Lifetime. Wow.
Yeah. S. typhimurium tends to persist for maybe 3 to 6 months, sometimes longer. And critically, remember the stress factor.
Right. Stress triggers it.
Stress can trigger shedding or even full-blown clinical disease in these seemingly healthy carriers. That makes them a kind of ticking time bomb within the herd. Very hard to manage.
Are there specific clinical pictures that might point a vet towards one serotype versus another, like S. Dublin versus S. typhimurium?
There's definitely overlap, but yes, there are tendencies. S. Dublin is more commonly linked to respiratory disease in calves and those abortions in adults. And it often leads to the more severe systemic complications, like the sloughing at extremities and joint infections we mentioned. S. typhimurium, on the other hand, is more commonly associated with that severe watery diarrhea and dysentery picture.
Oh, okay. So when a vet examines an animal they suspect might have this, what are they looking for specifically in terms of physical signs?
A thorough physical exam will often reveal common findings, like an elevated body temperature, typically that 40.5 to 41.5 Celsius range. Varying diarrhea characteristics could be watery, could be mucoid, often foul-smelling, possibly with streaks of blood. You'll also often see depression, lethargy, a lack of appetite, signs of dehydration like sunken eyes or skin tinting, that straining, the tenesmus, abdominal pain if you palpate them.
And in dairy cows, the milk drop.
Yes, definitely decreased milk production. And with S. Dublin specifically, you might look for those respiratory signs, especially in calves. In some severe systemic cases, you might see jaundice or find enlarged organs like the liver and spleen, or enlarged lymph nodes on palpation.
So once these signs are seen, how do veterinarians solve the mystery? How do they confirm if it's actually salmonellosis versus something else that looks similar? What are the diagnostic approaches?
The diagnosis always starts with strong clinical suspicion. Based on the patient's history, the signs they're showing, their age, the signalment. But it's absolutely crucial to differentiate salmonellosis from other enteric diseases that cause similar symptoms.
Like what?
Well, in calves, you need to rule out things caused by E. coli, rotavirus, or coronavirus. In adults, you might think about John's disease or chronic BVD, which can also cause diarrhea and wasting.
So you need more than just symptoms. You need lab confirmation, right?
Precisely. A definitive diagnosis relies on laboratory confirmation, and this often requires a multimodal strategy. You usually need a combination of bacterial, molecular, and maybe serological methods. No single test is really sufficient on its own.
Okay, so what's considered the gold standard test? The main one?
That would be bacterial culture. Isolating salmonella from feces is the gold standard.
Why is culture so important?
Well, it's crucial not just for confirming the presence of the bacteria, but also for determining antimicrobial susceptibility. That tells us exactly which antibiotics will actually work against that specific strain. That directly guides treatment decisions.
Ah, right, because of the resistance issues.
Exactly. And culture also allows for serotyping, which identifies the specific type, like typhimurium or Dublin. That's vital for epidemiological investigations, understanding how the disease is moving within a herd or even a region.
How does that work practically? Collecting samples.
For sample collection, vets typically ask for a decent amount, maybe 10 grams or more, of fresh feces, and ideally from at least 3 untreated calves showing signs. An important step in the lab is an overnight enrichment process, which helps the salmonella grow even if there aren't many bacteria there, enhancing detection. Typical turnaround times for enteric samples range from maybe 8 to 72 hours, depending on the lab and methods.
And what about faster, more modern methods? Is there anything quicker?
Yeah, that's where molecular diagnostics like PCR come in, polymerase chain reaction.
TCR.
PCR is a rapid technique. It detects the Salmonella DNA directly, rather than waiting for it to grow. It's primarily used for environmental surveillance, like testing swabs from pens. But for fecal samples, it's typically run alongside bacterial culture to enhance sensitivity. It does offer a quicker turnaround, maybe 36 to 72 hours when run with culture.
What's the role of serological testing then? Things like ELISA.
Right, so ELISA tests, think of them as a detective, looking for the immune system's reaction to Salmonella, rather than the bacteria themselves. They detect antibodies, which are the body's defense signals.
So it tells you if the animal has been exposed.
Exactly. It tells you if an animal has been exposed or may be vaccinated. This is particularly useful for identifying those asymptomatic carrier animals, the iceberg cases we talked about, and also for assessing how well vaccination programs might be working in a herd.
Are there any other diagnostic aids vets might use?
Well, less definitive aids include things like microscopic examination of fecal smears, looking for certain types of cells.
Yeah.
More in-depth options, usually done post-mortem if an animal dies, are histopathology and immunohistochemistry, IHC. These involve looking at tissue samples under a microscope to identify characteristic lesions, the damage caused by the bacteria, and using special stains, IHC, to confirm the presence of the bacteria right there within the tissues. Is a really clear picture of the damage.
So once it's confirmed, once you know you're dealing with it, how do we fight back against bovine salmonellosis? What are the key treatment strategies?
Well, first, the outlook. Clinical recovery, if treatment is successful, typically occurs within maybe 7 to 10 days. Full recovery might take 2 to 3 weeks. Though it's worth noting, some animals, especially dairy cows, may never return to their full previous production capacity. That's a significant economic consideration.
Okay, so what's the first and most critical step in treatment, especially for those really sick animals?
Fluid and electrolyte therapy, that is absolutely the cornerstone. Aggressive fluid therapy is vital. Dehydration and electrolyte imbalances are the primary causes of sickness and death in these cases.
Right, the diarrhea causes huge fluid loss.
Massive loss. So for severe acute cases, especially in calves showing signs of shock, what we call hypovolemic shock, from fluid loss, intravenous fluids, IV fluids like lactated Ringer's solution, are essential. In severely depressed or comatose animals, sometimes they use hypertonic saline. First, a really concentrated salt solution to pull fluid back into the circulation, quickly followed by standard isotonic crystalloids, often with dextrose added to address low blood sugar.
And for adult cattle, is IV practical?
For adults in the field, large volume IV can be tricky. So often it's hypertonic saline followed by large volumes of oral electrolytes or just plain water getting fluids in however you can. For moderately dehydrated calves that still have a suckle reflex, oral electrolyte solutions are suitable, but they need to have the right balance of sodium, sugar, and osmolality to ensure the gut can actually absorb them efficiently.
And what about the acidosis, the blood chemistry getting messed up?
Right. Severe metabolic acidosis can happen, especially in those peracute cases. Intravenous bicarbonate-rich fluids might be considered to help correct that body chemistry imbalance. It's really intensive fluid management.
What about antibiotics? We hear so much about concerns around antimicrobial resistance these days. How do you fit into the treatment plan here? Is it controversial?
It is, yeah. This raises an important question regarding antimicrobial use. It's definitely a subject of ongoing debate because of those concerns about resistance, AMR. Now, while antimicrobials may aid clinical recovery, their impact on actually limiting fecal shedding of the bacteria is controversial. It might not stop them shedding it.
So they might feel better but still be contagious.
Potentially, yes. Generally, though, antimicrobials are considered justified in calves. That's because they have a high risk of the bacteria spreading systemically, causing complications like pneumonia, arthritis, or meningitis. Ideally, the choice of antibiotics should be guided by those culture and sensitivity results we talked about, and focusing on narrow-spectrum drugs where possible to minimize the impact on other bacteria and reduce resistance pressure.
And for adult cattle?
For routine use in adult cattle, antimicrobial use is often considered less justified. Their risk of systemic spread is generally lower compared to calves. The absolute key is judicious use. Avoiding indiscriminate application, using the right drug for the right duration only when necessary. We really need to be smart about how we use these precious tools.
Okay. Besides fluids and maybe antibiotics, what other supportive care is important? What else helps animals recover?
Good question. Non-steroidal anti-inflammatory drugs NSAIDs, like flunixin and meglumine, are often used. They help reduce fever, pain, and inflammation in diarrhea calves. There's even evidence a single dose might reduce morbid days, basically shorten the duration of illness.
Okay, that sounds useful.
It can be, but caution is advised, typically not exceeding 3 doses because higher prolonged doses can potentially damage the intestinal lining.
Okay. Anything else?
For valuable calves or adults that have very low protein levels in their blood, hypoproteinemia vets might use colloids, things like plasma transfusions or a synthetic colloid called hetastarch. Plasma has the added benefit of providing some immunoglobulins, some antibodies. Dietary management also plays a role, maybe briefly withholding milk or milk replacer for 24-48 hours in calves, then gradually reintroducing it, and ensuring adequate feed and fiber intake for adults to support gut health.
Is there anything vets specifically avoid using?
Yes, it's generally recommended to avoid motility modifiers, drugs that slow down the gut, or things like intestinal protectants like kaopectate or bismuth. There's a lack of strong efficacy data for them in cattle salmonellosis, and there's a theoretical concern they might actually prolong the illness or increase sickness by keeping toxins in contact with the gut lining longer.
Right. Okay. So, given how persistent and tricky this pathogen is, how do we build a shield against this threat? What are the most effective prevention and control strategies? This seems crucial.
Absolutely. Effective prevention requires a comprehensive, multi-pronged strategy,
Yeah.
and it demands continuous vigilance. Because of Salmonella's environmental persistence and those asymptomatic carriers, you can't just fix it and forget about it. It requires ongoing effort.
Let's start with biosecurity then. How do you minimize exposure in a herd? What are the key steps?
Okay, controlling animal introduction is paramount. Number one risk factor. The ideal, theoretically, is a closed herd, meaning no new animals come in at all.
But that's not always practical.
Not always practical. So if new animals must be introduced, they should come from test-negative or known low-risk herds. And they absolutely must be quarantined.
How long for quarantine?
At least 2 to 4 weeks, ideally 21 to 30 days. This is to detect any incubating disease. And during quarantine, you need strict separation, no nose-to-nose contact with the main herd. But, crucially, remember, quarantine alone is insufficient to detect those silent carriers, so testing during quarantine is really important too.
Okay, what else falls under biosecurity? Hygiene.
Environmental hygiene and sanitation are also absolutely critical. This means providing clean, dry, well-ventilated calving pens, avoiding group calving areas where disease can spread easily. Calves should be promptly removed from their dams after birth and moved to separate, clean housing.
Separate equipment is important too, right? For feed and manure.
It's essential. Separate equipment for feed and manure. If it absolutely must be shared, it needs thorough washing and disinfection between uses. All equipment used between animals, pails, bottles, oral medication equipment must be sanitized. And remember the warning about high-pressure hosing. Be cautious due to that aerosolization risk. Ensure clean water sources and restrict access to potentially contaminated surface water like ponds or streams.
What about manure management specifically? How should that be handled?
Right, manure management is key because that's where the bacteria are shed. Ideally, manure should be spread on flat cropland areas where sunlight and drying can help kill pathogens, or delay grazing on pastures where manure has been spread for at least 30 days. Storing manure properly, like in a designated pile or lagoon, for 60 days in summer or 90 days in winter can also significantly reduce pathogen viability before spreading. And obviously, contaminated bedding, waste milk, and feed must be disposed of properly, not just left lying around.
You mentioned something surprising earlier, pests.
Yes. Pest control plays a major role. Rodents, wild birds, even farm cats and other wild animals can actually act as salmonella reservoirs and spread it around. So comprehensive pest control programs around feed stores and barns are essential.
And people are vectors too.
Absolutely. Stringent personal hygiene is critical for everyone working on the farm. Proper hand washing and changing coveralls and boots when moving between different groups of animals, especially between sick pens and healthy groups, or after handling sick animals. Basic stuff, but vital.
What about managing colostrum in milk, especially for those highly vulnerable young calves? You stressed this earlier.
This is truly crucial for young calves. Their immunity depends on it. Calves must receive adequate colostrum, remember, about 10% of their body weight within the first 4 to 12 hours of birth. This provides passive immunity, those vital antibodies from the mother.
Where should the colostrum come from?
Ideally, colostrum should come from Johns negative cows, and if possible, cows known to be salmonella negative. And pooling colostrum from multiple cows should be avoided if possible, as one infected cow can contaminate the whole batch.
And after colostrum, the milk feeding.
When it comes to milk feeding, whenever possible, pasteurized milk or a high-quality artificial milk replacer should be fed. And I'll say it again because it's so important. Pooled raw milk or waste milk containing antibiotics should never be fed to calves. It is a huge source of transmission for Salmonella and other pathogens, a major risk factor that needs to be avoided entirely.
Okay. Are there vaccines available for this? And how effective are they as part of a prevention plan?
Vaccination can be an important component, yes. It helps enhance animal resistance. For example, there's a vaccine called Bovivax used in some regions, which covers both Salmonella Dublin and Salmonella typhimurium.
How is it used?
It can be administered to animals over 3 weeks of age, usually requires 2 subcutaneous injections given 3 weeks apart. Ideally, vaccination timing is important. It should be completed before the drying off period in dairy cows and within about 8 weeks of calving. This helps protect them during those high-stress periods around birth when shedding is known to increase.
Are there limitations?
Yes. Importantly, no Salmonella vaccine is currently licensed and available for use in cattle in the United States, so that's a major limitation here.
Oh, okay. Good to know.
And even where vaccines are available, it's crucial to remember that vaccination alone won't eradicate other diseases like John's. It reinforces that vaccination is just part of a broader strategy, not a magic bullet.
Makes sense. So what else can producers do to maximize their animals' own natural resistance, building on that point about stress you made earlier?
Right. Beyond directly fighting the pathogen, it's crucial to enhance the cattle's natural resistance. This comes back to implementing stress reduction strategies. We know stress directly triggers disease, so things like ensuring adequate feed intake during that critical peri-parturient period around calving, preventing cows from getting overconditioned before calving, minimizing metabolic disorders like milk fever or ketosis, which are stressors themselves.
Nutrition plays a role too.
Definitely. Nutritional management is vital. Maintaining a balanced ration with adequate fiber intake supports overall well-being and gut health. And finally, working closely with a veterinarian, developing a tailored herd health program for that specific farm. This includes continuous monitoring for sick animals and having protocols for immediate isolation. It's really about creating a robust, healthy environment where animals are just less susceptible in the first place.
Wow, what a deep dive into bovine salmonellosis. It's clear this is a persistent, really multifaceted threat to cattle health, to agriculture, and with those significant public health implications too.
It really is. It's a complex epidemiology. With that stubborn environmental persistence and those insidious asymptomatic carriers, it truly demands a comprehensive and integrated control strategy. You can't just tackle one part.
Indeed. We've gone from defining the culprits like S. Dublin and typhimurium, understanding their remarkable resilience, surviving for years,
Yeah, it's amazing.
to grappling with the staggering economic costs, both for human health and the industry and the animal welfare side too.
And recognizing the varied clinical signs, from pericute death in calves to chronic wasting, and applying that multimodal diagnostic approach, culture, PCR, serology, are such crucial first steps in actually identifying the problem.
And then fighting back, with aggressive fluid therapy being the absolute cornerstone.
Vital.
Judicious antimicrobial use, navigating that resistance issue carefully, and a whole host of supportive care measures.
But ultimately, as you said, prevention is key. Through that multi-layered approach, stringent biosecurity, careful colostrum and milk management, especially avoiding raw pooled milk, and enhancing the animal's natural resistance by minimizing stress.
It truly is a testament to how interconnected health is, highlighting that one health approach you mentioned right at the start: animal health, human health, environmental health, all linked.
This whole challenge really makes you think about those hidden connections, doesn't it? Things we might not normally consider.
It absolutely does. So as you, our listener, go about your day, perhaps ponder this. How might these insights about stress acting as a disease trigger, or the incredible long-term environmental persistence of pathogens, how might those apply to other areas of health and disease, whether it's animal or human health, in ways maybe we don't always immediately recognize? What stands out to you most about this really intricate dance between a pathogen, its host, and their shared environment?